Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Nasal cancer. Introduction. Nasal cancer starts in the cells of the nasal cavity or paranasal sinuses. Your paranasal sinuses are small, hollow spaces around the nose. Cancer of the nasal cavity and paranasal sinuses is rare, but smoking, exposure to certain workplace chemicals, and HPV infection are factors that can increase a person's risk of nasal cancer. This program will help you better understand what nasal cancer is and what treatment options are available. It does not discuss skin cancers that can affect the skin of the nose. The nasal cavity and paranasal sinuses. The nose opens into the nasal cavity, which is divided into two nasal passages. Air moves through these passages during breathing. Sinuses are empty pockets filled with air in the head. There are 4 pairs of sinuses in the skull. These sinuses are the maxillary sinuses, the ethmoid sinuses, the frontal sinuses, the sphenoid sinuses. The paranasal sinuses are located around the nose. Paranasal means near the nose. Sinuses circulate air and lubricate the nose, keeping it free of bacteria and dust. The sinuses are lined by special cells called mucosa that secrete mucus. Mucus helps trap dirt from the air we breathe. The dirt is then expelled to the outside using small hair-like attachments known as cilia. Mucus also keeps your nose from drying out. All sinuses are connected to the nasal cavity through small tube-like openings. Nasal cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. A benign tumor is a non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For instance, a nasal tumor may grow through the outer layer of the nasal cavity or paranasal sinuses and to nearby tissues over time. Cancers in the body are given names depending on where the cancer started. Cancer that begins in the nasal cavity or paranasal sinuses will always be called nasal cancer, even if it spreads to other places. There are many different types of nasal cancer. This program focuses on the most common type of nasal cancer, squamous cell carcinoma. This type of cancer forms in the thin, flat cells lining the inside of the paranasal sinuses and the nasal cavity. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Risk factors. It is usually impossible to specify the cause of cancer in an individual patient, but we do know what causes cancer in general. Healthcare providers also know factors that can increase the chances of getting cancer. These are known as risk factors. Being exposed to certain workplace chemicals or dust raises the risk of nasal cancer. This includes jobs in a flour mill or bakery, a sawmill, furniture making, metal plating, woodworking or carpentry. Other risk factors for nasal cancer include being male, being over 40 years old, having an HPV infection, smoking. Not everybody who has risk factors for cancer gets it. Some people who have no risk factors for cancer can still get cancer. Symptoms. Nasal cancer may not cause any symptoms at first. Symptoms often start after the cancer is grown. Common symptoms of nasal cancer include chronic sinus infections that do not respond to treatment with antibiotics, loose teeth or dentures that no longer fit well, nosebleeds, sinuses that are blocked and do not clear. Other common symptoms of nasal cancer are eye problems such as swelling or double vision, frequent headaches, numbness or tingling in the face, pain in the upper teeth, pain or pressure in the ear. Nasal cancer may also cause a lump or sore inside of the nose that does not heal. In some cases, a lump may appear on the face or roof of the mouth. These symptoms may not be caused by nasal cancer. Make sure to see a healthcare provider to find out what is causing your symptoms. Diagnosis. Your healthcare provider will ask about your personal and family medical history. A physical exam will be performed. Your healthcare provider will look at your nose, face, and neck. A small, long-handled mirror is used to check for abnormal areas. Your face and neck will also be checked for any lumps or swollen lymph nodes. Imaging tests of the head and neck can be done to find tumors. These tests may include X-rays or an MRI. A nasoscopy may be performed to look inside the nose for abnormal areas. A thin, lighted tube is inserted into the nose. This tube is called a nasoscope. A laryngoscopy can be done to look at the voice box or larynx for abnormal areas. A thin, lighted tube called a laryngoscope is inserted through the mouth or nose. During either a nasoscopy or laryngoscopy, tissue samples may be taken. This is called a biopsy. The samples are then viewed under a microscope to check for cancer cells. A biopsy may also be done using a needle to remove a small amount of tissue or fluid. This is called a fine needle aspiration biopsy. A biopsy is the only sure way to know if cancer cells are present. Staging. If you have nasal cancer, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer is spread, and if so, to which parts of the body. There is no standard staging system for cancer of the sphenoid and frontal sinuses. Other types of nasal cancer are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. The stage of cancer is determined based on the size of the tumor, whether the cancer has spread to lymph nodes, whether the cancer has spread to other parts of the body, and if so, where. Additional tests may be done to learn the stage of cancer. Sometimes staging is not complete until after surgery to remove the tumor and nearby lymph nodes. An endoscopy may be performed to look at organs and tissues inside the body and to check for abnormal areas. A thin, lighted tube is inserted through an opening in the body, such as the nose or mouth. Samples of tissue may be taken for testing. Additional imaging tests can be done to find out if the cancer has spread, including bone scan, chest X-ray, CT scan, PET scan. Treatment and supportive care. The type of treatment for nasal cancer depends on the size and location of the tumor, the stage of the disease, and the health of the patient. Treatment for nasal cancer may include surgery, radiation therapy, chemotherapy, or some combination of these treatments. Surgery is the most common treatment of nasal cancer. It often involves removing the cancer and some of the healthy tissue and bone around the cancer. If the cancer has spread, the lymph nodes and other tissues in the neck may need to be removed. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. The way the radiation therapy is given depends on the type and stage of the cancer being treated. There are two types of radiation therapy. External radiation. This therapy uses a machine outside the body to send radiation toward the cancer. Internal radiation. This therapy places needles, seeds, wires, or catheters containing small amounts of radiation into or near the cancer. Chemotherapy uses drugs to kill cancer cells. Chemotherapy may be given in the bloodstream through an IV or taken by mouth. It can also be placed in a specific area of the body. The type used depends on the type and stage of the cancer being treated. Cancer and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms. The goal is to relieve the side effects of therapy and help you cope with emotions. Supportive care also deals with the pain associated with cancer and its treatments. Your healthcare provider or a pain control specialist can suggest ways to relieve or reduce pain.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Nasal cancer starts in the cells of the nasal cavity or paranasal sinuses. Your paranasal sinuses are small, hollow spaces around the nose. Cancer of the nasal cavity and paranasal sinuses is rare. People at risk for nasal cancer are exposed to certain workplace chemicals, have had an HPV infection, smoke. Nasal cancer may not cause any symptoms at first. Symptoms often start after the cancer is grown and may include chronic sinus infections that do not respond to treatment with antibiotics, loose teeth or dentures that no longer fit well, nosebleeds, sinuses that are blocked and do not clear. Treatment options for nasal cancer usually involve surgery, radiation therapy, chemotherapy, or some combination of these three. Often cancer is most treatable in its early stages. Research already has led to advances that have helped people with cancer live longer. Research continues to find better ways to care for people with cancer.
Thank you for using Explain.